for me. Run through the land, you run through my soul. Bring me wisdom and peace. Run through all ages and all of life's stages. You bring me around to find my release.
Jan Lewis, welcome to be my guest. Today we have from Newton, Massachusetts, we have Dr. Stafford Cohen. And Dr. Cohen was a cardiologist, and he's also a corresponding faculty member at Harvard Medical School, and he has written this great book, and it's called Doctor, Stay By Me. Welcome.
Thank you for having me. A pleasure to be here.
Now, he was sharing before with us, you didn't really know what you were going to do, so you narrowed it down, to 3, law, business, or medical. Tell us the story about that.
Yeah, when I graduated from high school, I had no idea what I wanted to do.
Same here.
When I got into college, Brown University, the guidance counselor had me come in within 2 weeks and asked me, have you decided on a career, concentration? Do you know what you want to do when you graduate? And I said, I've narrowed it down. And as you said, I narrowed it down to law, business, or medicine.
And you know, your father wanted you to go to business, right?
That is true. Yeah,
My father did too.
Yeah, he wanted me to join him in business, and he wanted my brother to as well.
Yeah.
My brother is 54 weeks older than I, almost Irish twins, and my brother had preceded me to college 2 years prior to my entering because of a change in kindergarten age. Between his year and mine, I had to wait an extra year to go to kindergarten. In any event, with a straight face, the counselor said, I'm glad you've narrowed it down. Eventually, I decided to go to law school and follow my brother to Columbia Law. I applied to one law school, and during my last semester, I took a course in economics, and they had a lot of case law.
You're falling asleep in class.
And I found it boring, and I said I nodded off, but in fact, at times I slept through the whole class. I did well in the course.
How could you do well, though?
Because it was one test. One test.
You were good at math.
I was fair at math and
you got through
good
it.
at logic, and
you made it.
And when I read, I have a better memory for things I've read than an audio memory, things I hear. And this was a reading course, basically. I did quite well. I actually got top grade
you
on
aced it, right?
the final exam. But I knew that law was contentious, adversarial, and that's not my nature in the least. And even though I got accepted, I wrote them actually and said, can I defer going? Because I wanted to take pre-med, finish up my pre-med courses. I had some, but I needed more to get minimal pre-med for some of the medical schools. And they wrote back very nicely and said, oh, once you've been accepted, you're accepted for life. Well, it turns out I might be able to go to Columbia next semester if I've been accepted for life, but I would never do that. In any event, I took some pre-med courses at Boston University, Intercession, and then Harvard College Summer School, and then took some other courses and was fortunate to be on the waiting list, probably at the very top. 2 weeks before Boston University Medical School started for the year, I got an acceptance, and I was very grateful.
How did your family feel? Did your father take it okay?
Very good question.
I would think he'd be thrilled.
My mother was very supportive. My father was not supportive. But always, whenever we disagreed, I give my father enormous credit. If I had a good logical argument, I never argued with him. I just presented my case. He always accepted it, always. He didn't want me to go, not because I wouldn't be entering business with him,
Yeah.
because my brother had already set that stage by going into law, although my brother did work with him on legal things in his business. No, my father didn't want me to go because my father was of a generation when people went to hospital, a lot of them never came out.
Yeah, but you were going as a doctor, not as a patient.
That's right. But he said, why do you want to get involved in other people's sorrow, in other people's concerns? My father felt illness. To be involved with illness was...
That sounds like my grandparents.
Yeah, well, that's right. My father was never really good with dealing with his own illness or anyone else's illness. In fact, my father had a hernia repair. He never thought he was going to come out of the hospital. Yeah, and my father didn't like to visit friends in the hospital. It made him very nervous.
Yeah.
So illness made him nervous. He didn't want me to be involved. And he said, look, these people have their own problems. Why do you want to get involved?
What'd you tell him? Of course I do.
I told him that I thought I could handle it.
And you did.
And I was, in fact, I think if I was cut out for anything.
Yeah, that was it.
I was cut out for a career in medicine. It was...
When did you graduate med school? Where were you? You were at Harvard or Columbia?
No, I was at Boston University Medical School. I graduated in 1961 and was fortunate to be able to get an internship in the...
Residency. Where did you do your residency?
Well, I did 4 years at Beth Israel Hospital.
Yeah.
Internship, first year resident, second year resident, and then chief resident. But I did have a year of specialty training at Mount Sinai Hospital in cardiology. And then I was in the public health service in a research position in cardiovascular research in the public health service.
Was that like being a fellowship?
It's like a fellowship. I considered it a fellowship.
That's pretty cool.
Yeah, I thought that was wonderful.
Yeah.
It was a real exposure to real research, both human and animal research.
Talking again with Dr. Stafford Cohen. He's written the book, Doctor Stay By Me. It's a medical memoir, and it's a collection of wonderful stories. And, of course, we're going to talk about the one that is my favorite. Share with them about the bulldog.
Yeah. That's a wonderful story. It's a true story. A lot of the stories, in fact, only a few, I got permission from the family to state the story in the real way it occurred, in the sequence it occurred. The other stories I had to fabricate some of the circumstances. It's not fiction, it's actually factual, but some of the issues are changed for privacy. In any event, I saw a patient for the first time with severe congestive heart failure late in the game. He had switched doctors, justifiably in my view, because the doctor they had been seeing didn't seem very attentive to their needs, often double booked. Often they had to wait long periods of time while there to have the appointments and difficult in getting appointments at all. And the doctor never corrected to the patient's dissatisfaction the fact that when initially asked, what did you do as a career? Or he said, I was a painter, an artist, and it went into the record as a house painter.
Which is big.
So he tried to get it changed and never could get the record changed.
Yeah.
In any event, they changed their physician, and he was, as I said, in severe congestive failure.
How long were you his doctor? A year
I
or
was
two?
his doctor for several years, actually.
You really got to know this man. You
I
really
got to
did.
know him, and as just a little aside, I once heard the business associate of, the person who organizes the business end, the MBA, who looked after our division, telling a doctor that who was spending too much time seeing patients and running late, you have to shorten your visits. And I want them shortened to the extent that you don't have extraneous conversation. As a matter of fact, I don't even want you to ask a patient, "How is your dog Bowser?" I said, that's a big mistake. I overheard this conversation. I said,
Yeah.
a patient's pet is part of their family.
Yeah.
And going all the way back to the Greeks, they would say, involve the entire family.
Oh,
And
yeah.
that would be
Yeah.
involve the pet. So I saw this gentleman who really was an artist, an illustrator, and a well-known illustrator, and he had a pet bulldog named Winston. And if I saw him at the end of the day, they would ask, "Hey, would you like to come and see Winston? He's been in the car in the parking lot."
Yeah.
the
Did you go
Sultan."
down and see him?
I did.
See, that's...
and Winston was always so happy to
Yeah.
see his owner.
Yeah.
So this man became almost housebound, but he would get out each day and walk up a little incline of his driveway for exercise, which is advised, and Winston would follow him, and they would walk together, and if the owner slowed down, Winston would slow down. Eventually he became more and more troubled with illness and more frequent hospitalizations, and ultimately I think he was so severely ill, I was very disheartened that I had to leave for a medical meeting, and he was always asking, "Can Winston come and visit me?" And I would say, "I'd love to have your dog visit you here in the hospital, but hospital regulations don't permit it." And he would say, "Well, what's the difference? I'm in a private room and won't disturb anybody." I said, I understand, but I can't go against hospital regulations. And he had given me a catalog of all of his works and had written in it, to a patient with a bad heart, to the doctor who has a heart.
Oh. Do you
I
still
thought
have it?
I thought he'd want to scrub that out and write something different.
Do you still have it?
Oh, I have it.
Did
yes.
you frame it?
I have the catalog, and I have it, and I'll forever keep it.
Yeah.
In any event, I had to go to a meeting, and when I returned, I learned he had died. And I apologized. I gave my condolences to the wife, and I said I was so sorry I couldn't have Winston visit. And she said, "Oh, don't feel sorry. We worked it out."
Here comes the good part.
I said, "Who did you work it out with?" She said, "The nurse." The nurse told me she was shifting her from the evening shift to the late night shift, and if I come in at 1 a.m. with Winston all
Blanketed.
in a blanket.
Yeah. Smuggled in.
So she smuggled them in and out, and Winston and his owner had their goodbyes.
Did he bark, though? He didn't even bark?
Oh, no. The dog was very, I think, well-behaved. Well-behaved. And it was all because a compassionate nurse knew how to get things done, knew what was really right, did not want this gentleman to depart this earth without saying goodbye to his best friend.
This was one of many stories that Dr. Cohen has in here. Doctor, how can they get a hold of your book?
They can get a hold of the book very easily. It was published by an arm of Amazon, the publishing arm called KDP, Kindle Publishing, and it's on Amazon in softcover form and in Kindle form. And if you put in the search box the title of the book or even my name, the author, it'll come up. Yep.
This is the cover. We can zero in, Glenn, on the cover of his. He brought in a fantastic poster of. You got it? You already got it? Okay, because that is an amazing. And they do it for you at the hospital.
Yes, they do. Yeah.
Oh,
yes.
I thought maybe Staples had done it.
No. The hospital does it, and the hospital does many things for me in a most professional way.
Mm-hmm.
They're not only doing it for Beth Israel Deaconess, I think they're doing it for children's as well.
Yep.
Anything that has to be done in the way of illustration, that they do the PowerPoint slides for me,
Yeah.
and they even put them in the order that I wish, and they're terrific.
Do you
They're
give many
wonderful.
presentations all around the area?
I've given over the years, absolutely, and they're always set up very nicely. And if I were to give a book talk at a bookstore, I would bring this poster.
Yeah, oh, definitely. You put it
yeah.
up on the easel. People see it right there.
That's right. Yeah,
Yeah.
and when the first book I did,
Oh, yeah, Paul
I'll
Zoll.
hold this up, Paul Zoll, MD.
Yeah.
As a matter of fact, he died in 1999. This is a biography of a wonderful innovator, pioneer in cardiology. Every year they have a memorial lecture, and I often have brought the poster,
Yeah.
a poster of this cover, not the new one, but and set it up for the memorial lecture. And I speak about Paul Zoll for about 5 minutes, and then the lecturer is introduced separately.
Do
But
you
I
do you actually give about your book and about your feelings about the medical profession nowadays? Do you do that? Especially med students.
Yeah, well, yeah, I have a lecture already scheduled for the medical schools, with the medical students in May of this year, the Harvard medical students. I try to get one at my own medical school, Boston University. I think once I do the one at Harvard, I'll have a little more leverage maybe in getting one
UMass would
done.
love to have you over there.
I'd be happy to
Oh,
give one.
God, yeah.
But medical students nowadays, I think, go into medicine, all medical students, with a mission. And the mission, if they're going to be in clinical medicine, is to get to know their patients, to help cure and heal. And if they can't really cure or heal, to help and to really help their patients get through their illness. They all want to do that, but the average time that a clinician is given nationwide is only about 10 minutes. Now, I think in our big medical centers here, the administrators are more enlightened. It may be 15 minutes. But there's a lot of burnout, and that's what the medical students aren't prepared for, because they can't fulfill the mission in the time allocated that they had gone into the profession for. I think the profession is really the most remarkable profession. It's a noble profession. It's a time-honored profession. And you had asked earlier about the cover. Yeah, I mean, the doctor and the patient have a bit of a contract that's sealed with a handshake. And the doctor is supposed to be the full advocate for the patient, and the patient should be trusting and truthful to their doctor. It's very hard for a doctor to be a full advocate for their patient when they have to advocate not only for the insurance company and their own institution and the guidelines, and they should certainly never be a self-advocate, be advocating for themselves. It's very interesting, I found. The editor of the Saturday Review about 40 years ago said a newly minted doctor comes out with a doctorate degree in one hand and technology
Oh,
and
God.
pharmacology and the other.
Yeah.
And that's Norman Cousins.
I've got his book, Anatomy of an Illness. I bought it for my husband who's going through hell with chemotherapy.
Well,
Laughter.
well, Norman Cousins has written several books.
Was he a doctor?
No, he wasn't a doctor, but he had an illness.
Yeah,
And he had an illness that his doctor said might be fatal. And what he did was, he said, if I'm going to die, let me die happy. I love to have movies of Abbott and Costello and have happy movies. So he showed all these happy movies to himself. He laughed, and he called it laugh therapy.
Yeah.
As a matter of fact, the doctor was wrong. He didn't have a fatal illness.
Yeah,
And,
I know.
I actually met that doctor.
Did you meet Norman Cousins?
I didn't meet the Norman Cousins, but I met the doctor, who was a social.
Yeah.
He looked after socialites like Pearl Bailey.
You made a great point about the anesthesiologist, and please be honest, because if you don't tell your anesthesiologist, let's say you're a kid these days, whatever, you smoke pot, maybe you drink a little, all these things, he's got to know, he or she. It's because, I heard correctly, that the anesthesiologist is the one who really has the patient's life in their hand. They can stop a surgery if things go wrong, right?
Absolutely right, and people don't appreciate the pressure the anesthesiologists are under. Yeah, and if something goes wrong, the surgeon will say it's the anesthesiologist's fault because they should have warned me that the blood pressure was dropping or something. It's the anesthesiologists that really are looking at all the vital signs during surgery, and they're the ones that really, for the most part, have your life in their hands. All surgeons make mistakes, but I won't say make mistakes, have unexpected things happen, not that it's a mistake. But the super surgeons, the fabulous surgeons, they figure out how to overcome it very quickly.
Yeah.
The not so great surgeons, the average surgeon, takes a little more time, and that can be crucial time.
Did you ever stay in and observe the cardiology surgeries on patients that you had sent to a surgeon?
You asked. You're a wonderful interviewer.
Oh, I'm very curious. I've always
Well,
heard
because that question is one that I wouldn't expect, but I absolutely have.
Yeah,
I used to go in when I had a patient that needed heart surgery.
Yeah.
I would actually go in to the operating room, scrub up, go in and observe and see what happened. And if I could be of any help with the cardiovascular issue, if it came up, I would comment. The anesthetists now are so good. They do echocardiograms during the surgery, if it's valve surgery. They do all sorts of things extremely well. But this was before that day. And I was in with a patient, and the surgeon, who's an excellent surgeon, there was hemorrhaging. And when I heard him say, if we don't fix this promptly, the patient's going to exsanguinate and die, my hair stood up on
end. And the patient could hear this?
No, this is in the middle of open heart surgery,
right.
fully anesthetized.
Yep.
I heard it.
Yeah.
That's the last one I went into.
You had it, yeah.
I said, I've had it.
Yeah.
My nerves can't take it. The surgeon, they're used to this.
Yeah.
You know,
Yeah,
life
they listen
on
to
a
music
thread.
in the operating room, I hear nowadays. They listen to the oldies. I had a surgeon, he's listening to the oldies.
Oh, they play nice calming music.
Well,
yeah.
this was, I don't know what he was listening to, but
no,
too bad I didn't get to hear it.
No, they play calming music so the whole staff can hear it.
It's so quiet in there. I've been awake for 3 hours in those things, and I get to watch what each person has a quiet duty to perform. It's just like a team. It's like a team.
Some surgeons will not operate unless they have their full team with them. If a crucial team member, like a nurse or something, scrub nurse, isn't there, the surgeon will prefer not to operate with a newcomer. Yeah.
Well, how do you tell the patient who didn't eat that morning and got up at an ungodly hour to get there, oh, well, sorry, I didn't have who I needed?
Well, I think if that were the case and the surgeon said, look, I have a well-oiled smooth running team, and if it's not going to be that way, I don't think you'd want to have me operate. The more important thing nowadays, by the way, when we talk about sleep deprivation, the trainees in most programs now have limited hours that they will work consecutively. They're not supposed to work 2 consecutive days and be sleep deprived and make a mistake. That doesn't apply to the surgeon.
That doesn't make sense. Yeah.
No, there's no rule about the surgeon. And some patients are told, ask the surgeon if they're going to be on duty the night before.
Oh, I never thought
for
that.
Emergencies. And if the surgeon says, yes, I will be on duty the night before, the patients, or some of them are advised, hey, if that's the case, change your surgical date.
Good advice. We got about 5 minutes. What would you advise people going into med school right now, with all of your great humanitarian outlook on this, like face-to-face with your, getting to know your patient? What would you advise?
I advise exactly that. Get to know your patient. If you're going to be in a clinical specialty like primary care, if you're going to be emergency medicine, which isn't primary care, but it's stressful. If you're going to be in family medicine, pediatrics, looking after patients, try to get to know your patients, because you will get far more satisfaction in what you're doing. And even though in the book I speak about burnout in those specialties, I didn't focus on why, if half the doctors and half the patients are unhappy, why the other half are happy.
Yeah.
Well, if you're a doctor, and what would I advise? Get to know your patients. Get to have time to know your patients. Find a situation where the administrators will give you more time if necessary for a complex patient. Get into a practice where you have great faith in your colleagues and you will communicate with them and appreciate them and cover for them if for some reason they can't perform a task, because you know they will cover for you. Have time for continuing education. Make sure that you have time to go to a meeting in your setting. Some doctors have written me after reading the book.
Right.
And I'll give you an idea of one of them. One of them said that they've taken great pains to shift around their primary work site. And this doctor said he's found a situation where the administrators are very understanding. In previous situations, he's been told, do it faster, you're spending too much time.
Yeah.
He refuses. He says, if I do it faster, I'm going to miss something. And I am finding things, say he does colonoscopies, for example. No, he's a gastroenterologist, he said, where I'm finding things that have been missed by someone who 6 months ago did a procedure.
Even by an MRI and a CAT scan, my husband's was missed.
Okay.
It took a colonoscopy to find it.
Yeah, well, he said, I make sure I take time. I won't reduce the time for the procedure. I make time to sit down with the patient at their level, not stand above them. Ask questions. Ask them if they have questions. Make sure the family has time to answer questions. And he said, I am honoring my professional duties, and I hope I can continue to do so, because things have gotten a little worse year after year in the patient-doctor relationship. and hopefully it can be repaired.
Thank you.
The second letter was a brief one, and it was signed by Burning Out.
Oh.
Burning Out. And it was very brief. It said, "Thank you for reminding me why I went into medicine in the first place."
Thank you for being with Dr. Stafford Cohen. He was a cardiologist. He still is. I can't say was. He is a corresponding faculty member at the Harvard Medical School, and he has the book Doctor Stay By Me, and you can get a copy. They'll be right down in the dedicated author's wall downstairs in the Upton Library. Also Amazon.
Yeah, it's on Amazon.
Open to that.
Oh, I can be reached through my website or through Stafford Cohen at gmail.com.
And there you are. Thanks for being with us.
Oh, thank you so much for having me. It's been a total pleasure.
I wish my son could meet you, because I know back when he was a little guy, he wanted to be, that's all he wanted to do.
Who is this?
My son.
Oh.
And I even made a group called Club Med in his elementary school.
Ah.
Grab their attention while you can. I took them out to Worcester to the UMass Life Flight. He got a tour of that. We had Doctor come in and speak. Unfortunately, in first or second grade, he brought his UMass stethoscope in for show and tell. The teacher there, in all her wacky wisdom, let the kids laugh at him and make fun of him.
Oh, my
He came home and he said, "I'll never do that again."
Oh.
And that's the same teacher who said to me, "Well, Jan, what do you plan to gain about this, about the Club Med for the kids?" I'm looking at her like, "Are you nuts?" In this day and age, if the kid shows an interest in something, you grab.
In anything.
Thank you, Dr. Cohen. We'll see you next time. Be my guest.